Before we start explanation and dissecting chiropractic exam, we need to explain the following is not necessary how I perform exam. This video intended for my patient that already had exam or people who haven't been my patient and they inquire how I perform exam. This is a typical exam. 90% of my patients are either back pain, neck pain, or shoulder patient. However, if somebody comes with the wrist pain, ankle pain, or different type of exam, or we perform different way of examination. So this is my regular exam form that is usually done for neck patient, back patient, and a shoulder patient. However, the very first thing usually I do in my office is doing vital sign. After that, we doing postural examination, range of motion of the neck, range of motion of the shoulder. Also, basically, palpation, that is most important part. We doing orthopedic assessment test, neurological test, and so on. And now we're gonna explain you how we do that in detail and why. Usually we start with vital sign. Believe it or not, vital sign will tell us whether you're a chiropractic patient, you need to be referred out, or how's your general health. And after that, we're gonna start with postural examination. Now, postural examination is super important because by observing your posture, it tells us a lot about you. So postural examination is mostly about us observing you, how you carry yourself, how you stand. Then after observation, we put our hand on you to check the level of your pelvis, for example, the level of your shoulder, the level of your head, how your head is tilted. And believe it or not, postural examination alone can tell us a lot of things, especially about your pelvis, if in case you have a back pain, or your shoulder, if it's higher on one side, lower on the other side, or if you have a neck tilt, it tells us a lot. Especially if you have muscle tone that is more contracted on one side versus the other side. We may even give you a separate sheet of paper that explains how maybe your sacrum is out of, or sacroiliac joint is out of balance and or is tilted. Next, we're going to do range of motion. Range of motion of the neck and back and shoulder in this case. Range of motion usually can differentiate from muscle issue and joint issue. Usually we start with the neck and we ask a patient to do flexion and extension, basically means bending forward and back. This test usually tells us more about joint than muscle. Then we ask to do rotation, so rotate side to side. This test usually tells us a lot about muscle, or lateral flexion, bending the neck side to side, and this tells us about both joint and muscle. Range of motion is being done two ways. One, doctor asks you to do it. Another way, doctor does it for you. If the doctor does it for you, it's called passive range of motion. If the doctor asks you to do it, it's called active range of motion. And both they give us a lot of valuable information, especially to differentiation from joint disorder and muscle disorder. You might see on exam our notes in different way. For example, if a flexion is 50 degree and you have 50-degree range of motion, we say no abnormality noted. Or if your extension is 30 degree versus normal should be 60 degree and you have a severe pain, we put SV and pain circle. These are abbreviation we use. Sometimes the same thing happening during the rotation. Or your lateral flexion is normal and we just write no abnormality noted. In case of your back, we have a different range of motion for back. Maybe you are bending forward 60 degrees normal, so we say no abnormality noted, versus when you bend in backward, we say you might have a moderate pain moderate with pain, or rotation is fine on your lower back, and so that's we say no abnormality noted. However, when the lateral flexion is moderate pain, we can see maybe a person has a joint pain in the back. Usually when we do range of motion examination in case of shoulder or neck or back, we have to combine them with postural examination and orthopedic tests and neurological tests to come up with better diagnosis. Next, we move on to most important part of the chiropractic exam we call art of palpation. There are four things we're looking in art of palpation. We're looking for misalignment, fixation, otherwise if joints are locked, not moving freely. We're looking for pain. Last but not least, we're looking for a spasm and muscle tone by way of palpation. Now let's say we palpate your very first vertebra and we notice it went out toward posterior or back and went up toward superior on the right side. So we write PSR. We go and palpate other places and we mark them, and notice those markings are not accidental or to one side versus the other. That means the subluxation or misalignment is more to that side. If the joint doesn't move, we put FIX, like for fixation. Every chiropractor, they have their own abbreviation. Or if you say I have pain at that joint, I will just put P with a circle, meaning has pain. Then it comes turns for palpating the muscle. Let's say we palpating on your lower back, let's say latissimus dorsi muscle, or we TFL muscle, tensor fasciae lata muscle, or on your neck we palpate your SCM muscle. If we find that they are very tough on a spasm, we just mark them. And then if we find out the muscle on top of being very tough and hard, we press on it and it has pain. On top of our marking, we put P and a circle. That means the muscle also is in pain. We note everything on the side, we write them. And especially sometimes for shoulder, if your AC joint is odd or muscle of your AC joint odd, we do the same thing, we write them. By the way, we could also palpate your ribs. Let's say your ribs 9 and 10 or 11 are out or fixated or in pain. We do the same thing. That's part of the palpation. Next are orthopedic assessment, orthopedic tests. These are type of tests that for various reasons either designed for muscle, nerve, and joint. There are over 100 tests. And I'm going to go mention a few of them here, like shoulder depression, foraminal compression, thoracic outlet syndrome. I did a video on a side with thoracic outlet syndrome, a straight leg raise test, or Patrick Faber test. All of this you can literally Google and see what is this for. If you see on my form, I showed you I done this, one of them are positive and I marked them. You can easily go on YouTube and Google them, or you see what's there. Believe it or not, ton of video exists about this. And this again, it will tell me more information about your body, and combining for what I already done, it will tell me what's going on with you. Next, we're gonna do neurological test. First, we're gonna do dermatomal exam or dermatome mapping, by basically checking every part of your vertebra by checking your skin. How we do that? There is an instrument called pinwheel. It's little tiny needles attached to a wheel that we run around your skin, and trust me, it's painless. However, it gives you sensation, and your sensation on both sides has to be exact. By checking the sensory part of your nerve, it tells us whether you have some type of interference on your peripheral nerve closer to your spine. Basically, when we run the pinwheel on both sides and one side is less sensitive or more sensitive, it tells us about the source, that it could be something interfere closer to your spine. Especially if you came to our office with a history of numbness in your hand or numbness in your feet, or you have a back pain with the numbness that radiates in your knee and ankle, That type of numbness, it could be definitely a neurological problem, especially in bulge disc. Now, when the sensation is increased in certain level compared to one side, we mark with arrow up next to that level. When the sensation is low to certain part, we mark it down, especially in case of the neck and back, which is super important for especially for bulge disc patient. Now, if there is nothing going on with you and your sensation is just fine, we mark it no abnormality noted, and hopefully that's the case. Now, last but not least, we're going to do reflex testing. Now, while the dermatome would check your peripheral nerve, reflex checks your spinal cord. Matter of fact, the reflex goes all the way to your spine and back. And by checking your reflex, we know health of your spinal cord at a specific level, especially with the cases of the neck disc, herniated disc, or low back herniated disc, or any space occupying lesion. This test is super crucial to determine how far or how severe you are. How do we do that? With the special hammer, reflex hammer, we hit a specific part of your tendon and we wait for the reaction. Now, this reaction or varies, could be normal, diminished, exaggerated, or absent. And we basically, with the abbreviation, we start marking those on our notes. This valuable information can tell us whether your back has a bulge or neck has a bulge, or however, you have to put all of this together with all other findings and come up with the differential diagnosis. Especially part of your history and what you're telling us is so important. Some people say is 80% of diagnosis is history of the patient, basically what you're telling us. However, this was the dissection of chiropractic exam. I hope you enjoy it, and if you've been to my office, you can look at the picture you took and see what's going on with your body. Thank you very much. Have a great and healthy day.